While the authorities and private organizations continue to roll out various programs to address the worrying issue of suicide, the human rights group Society Against Sexual Orientation Discrimination is calling for more in-depth, broad-based research to treat with the issue as a matter of urgency.
We haven't even in this country researched enough what exactly is causing the Guyana to have the highest per capita suicide rate in the world. We don't exactly know. There's still a lot of guesswork being done at the policy level.
Joel Simpson, head of Society Against Sexual Orientation and Discrimination, SASOD. While his group mainly offers support to the local lesbian, gays, bisexual and transgender community, Simpson opines that Guyana is quite deficient on the subject of mental health, which is often pointed to as the ultimate precipice that tips the scale of hopelessness and ultimately leads to suicide. He further posited that there is urgent need for revision of archaic legislation that does more harm than good for society in general.
A major issue is that attempted suicide is criminalized in Guyana. And that is an old law that needs to change, because if you want people to reach out for services and if you want people to admit that, hey, I attempted suicide and this is why and so on, and you want people to access those services in the public health system, then you can't criminalize the very behavior that you want them to get help for.
Additionally, he told Nightly News that for starters, there is need for better policies and deeper research to stem the tide, in addition to the authorities seeking, as a matter of urgency, the need for the deployment of more psychologists. While noting that his group is supportive of every intervention possible, much more can be done beyond talk shops.
We have to have more trained psychologists available in every hospital, public health center, youth center run by the Ministry of Education's Department of Youth, every safe space. We need school counselors, and all of them need to be sensitized about minority issues related to minority groups, not just sexual and gender minorities, but ethnic minorities as well, and other areas of diversity.
Closer to his group's purpose, he says, in the lesbian, gays and bisexual as well as transgender community, there are not many places to get psychosocial support in Guyana, and as such, his group is working feverishly to complete an LGBT mental health program.
We're in a phase now where we're doing a lot of research to really understand the situation better, so that when we garner resources for a program, that it's tailored to suit the needs of the population.
Mondale Smith, HGP Nightly News.